End-stage heart failure, causes and treatment. Heart failure occurs when the heart cannot pump enough blood to meet the body's needs. End-stage heart failure is the most severe form of heart failure. This video will discuss end-stage heart failure, including common signs and symptoms. It will also explain the causes of the condition and how to manage, treat, and help prevent it. What is end-stage heart failure? A person with heart failure experiences weakening of the heart over time. Management and treatment option can help a person live with the symptoms that heart failure causes. But heart failure is chronic and there is no cure. In end-stage heart failure, the body can no longer compensate for the lack of blood the heart pumps, and the heart has limited functional recovery. A person may find it difficult to breathe even when they are resting. Stages or classes of heart failure. The final stage of heart failure is also known as the end stage of heart failure. Doctors classify heart failure into stages A to D and functional classes 1 to 4 to level them in terms of severity and symptoms. This comes from the classifications to the American College of Cardiology and the New York Heart Association. According to the 2022 AHA ACC HFSA guideline for the management of heart failure, a person with end-stage heart failure typically has stage D. NYHA class 4 heart failure. If a person has class 4 heart failure, it means they cannot do much physical activity without experiencing discomfort, have symptoms of heart failure even when resting, experience increasing discomfort with any amount of physical activity. If a person has stage D heart failure, it means they have objective or observational evidence of severe heart disease, have severe functional limitations, experience noticeable symptoms even when resting. Other signs and symptoms of end-stage heart failure include frequent ventricular arrhythmias, worsening hypotension or low blood pressure due to intolerance to beta blockers, weakness and wasting of the heart muscle, deteriorating liver and kidney function, and repeated hospitalizations. Symptoms of end-stage heart failure. A person with end-stage heart failure may experience symptoms of cardiovascular disease. Symptoms may include difficulty breathing, fatigue or lack of energy, abdominal pain, severe unexplained weight loss, irregular heartbeat, fluid retention. End-stage heart failure can also cause a person to experience kidney or liver dysfunction. A person may require regular hospitalization or depend on daily intravenous medications, and their condition may not respond well to treatment. This can worsen as the heart failure progresses. Causes of end-stage heart failure. Heart failure can be chronic and develop over time due to medical conditions that make the heart work harder than usual or damage it. It may also be acute and develop due to conditions that cause sudden damage to the heart, such as heart attack or infection. Over time, heart failure may progress to the point where medications no longer work. Ventricular assist devices and heart transplants may be an option for some people, but others may not be eligible due to chronic illnesses or certain medical conditions. Heart failure tends to impact either the right or left side of the heart, but in both cases, heart failure causes the heart to be unable to pump blood correctly. Many conditions can cause or contribute to heart failure, such as coronary artery disease, diabetes, obesity, high blood pressure, valvular heart disease, inherited cardiomyopathy, toxins such as alcohol, cocaine, or methamphetamine. Managing and treating end-stage heart failure. There is no cure for end-stage heart failure. At this stage, people must decide how much treatment they would like without sacrificing their quality of life. Some people may wish to seek palliative or hospice care when they are in the final stages of heart failure. This option can help provide great comfort in a person's last weeks and days. Medications. Medications may help people with advanced heart failure manage their symptoms. Sometimes people with advanced heart failure cannot tolerate these medications due to side effects such as low blood pressure. Intolerance is usually a marker for advanced disease. Surgery. Some people may also undergo surgery to receive the following: ventricular assist device. This mechanical support device helps the heart pump blood. A person may need a left ventricular assist device, a right ventricular assist device, or biventricular assist device. Biventricular pacemaker. A pacemaker helps the heart pump more synchronously for more efficient blood delivery. Implantable cardioverter defibrillator. This device assesses heart rate and delivers electrical pulses to correct abnormal heart rhythms. They may also receive an artificial heart or a heart transplant. Some people may get a peripherally inserted central catheter or PICC line and receive intravenous medications at home to decongest the heart or to help support the heart's pumping while waiting for a transplant. Palliative care. Palliative care aims to improve the quality of life for someone experiencing a life-threatening condition and typically has less than 6 months to live. This may involve treatments to reduce symptoms and address the psychological, mental, emotional, or spiritual needs of patients, their caregivers, and their loved ones. It may involve treatments to extend life. Hospice care. Hospice care does not aim to extend a person's life. It seeks to manage their symptoms and relieve physical and emotional distress so people with end-stage heart failure can live as fully as possible with dignity and in comfort at home or in a hospice facility. How to prevent end-stage heart failure? There is no cure for end-stage heart failure. The exact outlook can vary from person to person. According to a 2018 review, those who have stage D heart failure usually experience a poor quality of life. People can use medications and other therapies or strategies to help reduce the discomfort that end-stage heart failure can cause. The best way to help prevent heart failure is to make lifestyle changes or establish habits that reduce the risk of developing conditions that cause or contribute to heart failure. The American Heart Association's Life's Essential 8 checklist highlights ways to help prevent heart failure. This include eating a heart-healthy diet, exercising regularly, not smoking or quitting smoking, getting enough sleep, maintaining a moderate body weight, managing cholesterol, managing blood sugar, managing blood pressure.